Now, to usher in the opening ceremony, I would like to call on IAPO's Board of Trustees Chair Dr. Ratna Devi, the IAPO Board Member and Congress Chair Karen Alparce-Villanueva. Over to you, Dr. Ratna.
Thank you. Good morning, good afternoon, good evening to delegates, speakers, sponsors, organizers, and everyone who's joined us today. Namaste from India. It's my absolute pleasure and delight to be addressing you today on day one of the two-day virtual Congress for the Asia-Pacific region. I welcome all delegates and speakers warmly and wish you 2 wonderful days of discussion and dialogue. IAPO is the only cross-disease patient alliance that is led by patients and patient leaders. We completed 21 years in 2020 and are in our 22nd year. We have a long and rich legacy that we are very proud of in patient empowerment and engagement. IAPO has over 300 plus members from 70 plus countries representing over 52 disease areas. We are a non-state actor in official relationship with the World Health Organization and work closely with WHO on various issues, including NCDs, patient safety, and rare diseases. IAPO drafted its 3-year strategic plan 2022-2024 with the 3 pillars of empower, drive research, and shape law, policy, and standards. Our first pillar, empower, talks about empowering members with cutting-edge knowledge and advocacy skills to enhance the reach, efficacy, and impact of our membership in bringing about healthcare that's patient-centered, pandemic-prepared, and focused on universal healthcare. Our second pillar, which is driving research, talks of co-creating evidence based in support of healthcare that is again patient-centric and focused on universal healthcare and strengthens patient involvement in clinical research and global health initiatives. The third pillar is shaping law, policy, and standards and applies the knowledge that empowered patient communities have gathered and uses the evidence base to create and shape the institutional law, policy, practice, and standards frameworks for creating healthcare that is patient-centered. Our mission at IAPO is to build patient-centered healthcare throughout the world, and more so in the Asia-Pacific region. Our journey started way back in 2014 with a regional workshop in Delhi, followed by 2 congresses in Taiwan 2019 and in India, which was a virtual one in 2020. The Asia and the Pacific region is home to 60% of the world's population, some 4.3 billion, and includes the world's most populous countries, China and India. The region has wide disparities in income, culture, and healthcare infrastructure. The share of the population over 65 years and over 80 will more than double in the next 4 decades, with the fastest growth happening in countries like Japan. Almost half of the health spending comes from payments made by households out of pocket in lower, middle, and low-income countries of this region. Healthcare decisions are not participatory, and there's a large dependence and trust in healthcare providers. Exploring alternatives or new techniques is not considered necessary. Similarly, healthcare decisions involving high expenses usually involve entire families and communities. Global economy is slowing, but APAC countries continue to record very strong growth. Alongside economic growth, out-of-pocket spending for healthcare also increased in the last decade. The main driver of out-of-pocket is medicines, composing more than 60% of the total out-of-pocket expenditure. In Bangladesh and India, the percentage could be as high as 80%. Furthermore, the share of medicines was even higher among poorer populations, suggesting a disproportionately higher financial burden. Leading in GDP are APAC's 2 largest emerging economies, India and China, though other countries are also showing an increasing trend. However, with the exception of Australia, most countries lag far behind the WHO recommendations for healthcare infrastructure and human resources. This Congress today and tomorrow will explore some of these nuances and how patients and patient communities can drive the much needed change this region needs. It is an honor and pleasure to have joined hands with Philippine Alliance of Patient Organizations and Duke NUS Medical Center to co-create and deliver this Congress. On behalf of the IAPO board, I would like to express our heartfelt thanks to them. I'd like to hand over now to Karen, Board Secretary IAPO and Board Member PAPO, to take the proceedings forward and declare the Congress officially open. I wish you the very best. Thank you so much.
Thank you so much, Dr. Ratna. Good morning and mabuhay to everyone. The Philippines is happy to host this year's third Asia Pacific Patient Congress. May I have my slides, please, Manish? As mentioned by Kara, we have more than 3,000 delegates from 26 countries representing patient groups, the academe, healthcare institutions, healthcare professionals, regulators, the industry, and students. Thank you for your interest in advancing the patient voice in our part of the world. Next slide, please. This year's theme of recovering together with compassion, insight, and co-creation is most appropriate as many countries in the world are starting to open up as vaccination rates have reached herd immunity levels and promising new treatments are going through regulatory review and clinical trials. Let us take this time to reflect on the lessons learned and together work towards a patient-centered healthcare system. Next slide, please. There will be 10 sessions with 50 speakers talking about relevant healthcare issues. Next slide. From universal health coverage to digital health, to patient safety, personalized healthcare, HTA and regulatory affairs, and even topics such as patient engagement, but all through the lens of the patient. And so I invite all of you to stay, learn, and ask questions for the next 2 days. We have prepared an impressive lineup of speakers, and make sure that you ask questions, okay? These speakers, moderators, and facilitators are very committed to the ideals of patient-centered healthcare. And allow me to thank our co-presenters, the Philippine Alliance of Patient Organizations, PAPO, and Sing Health Duke NUS Academic Medical Center for co-creating the agenda this year. Special thanks to our sponsors who support made this APPC possible, and to all of you who will devote their 2 precious days with us. Salamat po. Next slide. As chair of the 3rd Asia Pacific Patient Congress, I now declare the Patient Congress open. Play video, please.
Patient-centered healthcare defines us. Not only do we live for it, we are shaped by it. Being the global voice of patients is the core of who we are. We at the International Alliance of Patients Organization put the patient front and center. We listen. We speak your language. We understand your culture. We address your needs. The 3rd Asia Pacific Patients Congress is our most important venue for dialogue. This year's theme, Recovering Together Through Compassion, Insight, and Co-Creation. Together with the Philippine Alliance of Patient Organizations and Sing Health Duke NUS Medical Center, the Congress brings together patient advocates from across Asia to share insights, experiences, and best practices on the pressing healthcare issues. Meet others in the healthcare field. Create national and regional networks. Share expertise and speak out on behalf of the patients. Learn from leading healthcare experts. Discuss the changing healthcare climate. At no time in history have we experienced as a global village countless deaths and disease in quick succession. But together, we can recover and reboot our healthcare systems for the patients. Let's accelerate meaningful patient participation in all public and private platforms. Let's remember, expertise and wisdom is meaningless without compassion. Let's define a new and bolder world in healthcare. Let us dream big. Patients deserve only the very best.